In the world of medicine, discoveries often come from unexpected places. Clarithromycin, a commonly prescribed antibiotic, is now showing remarkable potential in a completely different arena, the fight against cancer. Originally used to combat bacterial infections, clarithromycin is now being investigated for its ability to target and destroy cancer cells. This journey from antibiotic to potential cancer fighter began with scientists exploring the unique metabolic pathways that fuel cancer growth. Clarithromycin disrupts these processes, cutting off the energy supply that cancer cells need to survive. This discovery has opened up new avenues in cancer treatment, offering a potential weapon for patients battling this complex disease. While still in the early stages of research, the findings surrounding clarithromycin's anti-cancer properties have generated significant excitement within the medical community. Join us as we unravel the fascinating story of clarithromycin, the unexpected cancer fighter. To understand how clarithromycin combats cancer, we need to take a journey back in time, to the very origins of complex cells. Billions of years ago, a simple bacterium was engulfed by a larger cell, forming a symbiotic relationship. This bacterium evolved into what we know today as the mitochondrion, the powerhouse of the cell. Mitochondria play a critical role in energy production, converting nutrients into ATP, the energy currency of cells. Cancer cells, with their accelerated growth, often hijack this process, relying heavily on mitochondrial activity. This reliance on mitochondria makes them vulnerable, and this is where clarithromycin comes into play. By targeting mitochondrial function, clarithromycin disrupts the energy supply chain that cancer cells depend upon. This unique mechanism sets clarithromycin apart from many traditional chemotherapy drugs, which often have widespread toxic effects. By targeting the organelles that cancer cells exploit, clarithromycin offers a promising avenue for developing more selective and effective cancer therapies. Now let's zoom in on how clarithromycin disrupts the mitochondria's energy production. Clarithromycin, being an antibiotic, interferes with protein production by targeting ribosomes. It specifically inhibits the ribosomes within mitochondria. By inhibiting mitochondrial ribosomes, clarithromycin disrupts the production of proteins essential for oxidative phosphorylation. Without these vital proteins, the mitochondria's energy production grinds to a halt, depriving cancer cells of the fuel they need to survive and grow. This mechanism makes clarithromycin promising as an anti-cancer agent. It exploits a vulnerability specific to cancer cells, their reliance on mitochondrial oxidative phosphorylation, while largely sparing healthy cells. This targeted approach offers hope for more effective and less toxic cancer therapies in the future. We've seen how clarithromycin disrupts the mitochondria's energy production by inhibiting oxidative phosphorylation. But this antibiotic doesn't stop there. It also hinders autophagy, a cellular recycling process that cancer cells often exploit to survive under stress. When cells are starved of nutrients, they activate autophagy to break down damaged components and recycle them. Cancer cells rely on autophagy to cope with the harsh conditions within tumors. Clarithromycin prevents cancer cells from recycling essential components, essentially starving them from within. This dual action, inhibiting both oxidative phosphorylation and autophagy, makes clarithromycin a formidable opponent against cancer. By targeting multiple survival mechanisms simultaneously, it offers a potential advantage over therapies that focus on a single pathway. Section 5, a two-pronged attack combining clarithromycin with glycolysis inhibitors. Clarithromycin excels at disrupting mitochondrial energy production, but cancer cells can switch to an alternative energy pathway, glycolysis. This metabolic flexibility poses a challenge in cancer treatment, requiring a multi-pronged approach. By combining clarithromycin with drugs that inhibit glycolysis, scientists aim to deliver a one-two punch, targeting both major energy pathways. This synergistic approach holds the potential to overcome the metabolic plasticity of cancer cells, preventing them from switching between energy sources. Several glycolysis inhibitors are currently being investigated in clinical trials, showing promise in limiting cancer cell growth. Combining these inhibitors with clarithromycin could create a powerful therapeutic strategy, exploiting the vulnerabilities of cancer cells. This combined approach reflects a growing trend in cancer treatment, moving towards more personalized and targeted combinations. Section 6. Targeting the root of the problem: clarithromycin and cancer stem cells. Targeting cancer cell energy pathways is crucial, but cancer stem cells, or CSCs, are also key. These cells drive tumor initiation, growth, and recurrence. Often resistant to conventional therapies, they hinder lasting remission. Clarithromycin might target these resistant CSCs. Studies show it targets CSCs in breast, lung cancer, and leukemia. This makes clarithromycin promising for effective cancer therapies. The mechanisms are still under investigation, but it may disrupt CSC's metabolic needs, leading to their eradication. Section 7. Promising results. Clinical studies and case reports. The preclinical evidence supporting clarithromycin's anti-cancer activity is compelling. Several clinical studies and case reports have emerged, providing encouraging results. One notable case report involved a patient with refractory multiple myeloma. The patient was treated with clarithromycin and other drugs. Remarkably, the patient achieved a complete response. Another study investigated clarithromycin in relapsed non-Hodgkin lymphoma. The study found a significant reduction in tumor size in some patients. Larger clinical trials are needed to confirm clarithromycin's efficacy and safety. Section 8. Lymphoma and myeloma, shining a light on specific cancers. Clarithromycin has shown particular promise in treating lymphoma and myeloma, both blood cancers that affect different components of the immune system. In lymphoma, clarithromycin has demonstrated the ability to inhibit the growth of malignant lymphocytes. This effect is thought to be due to clarithromycin's ability to disrupt mitochondrial function and induce apoptosis in these malignant cells. Similarly, in myeloma, clarithromycin has shown efficacy in inhibiting the proliferation of myeloma cells. Several clinical trials are currently underway to further investigate the potential of clarithromycin for treating lymphoma and myeloma. These trials aim to determine the optimal dosing strategies, assess the drug's efficacy in different subtypes of these diseases, and evaluate its long-term safety profile. Section 9. Safety first. Side effects and contraindications. While the potential benefits of clarithromycin as an anti-cancer agent are exciting, it's crucial to address the potential side effects and contraindications. The most common side effects reported with clarithromycin use include gastrointestinal disturbances such as nausea, diarrhea, and abdominal pain. These side effects are often temporary and can be managed with supportive care measures. In rare cases, clarithromycin can cause more serious side effects such as liver toxicity, allergic reactions, and heart rhythm abnormalities. Before prescribing clarithromycin, healthcare providers consider the patient's medical history, current medications, and potential drug interactions. It's essential for patients to inform their healthcare providers about all medications and supplements they are taking to ensure safe and effective treatment. Section 10. The future of cancer treatment. A new era of hope. The discovery of clarithromycin's anti-cancer properties marks an exciting chapter in the quest for more effective and less toxic cancer therapies. While still in the early stages of research, the potential of this common antibiotic to target cancer cells has generated considerable optimism. By targeting specific metabolic vulnerabilities in cancer cells, clarithromycin offers hope for more precise and effective treatments with potentially fewer side effects. The future of cancer treatment lies in understanding the complex interplay of cellular processes that drive cancer growth and progression. Clarithromycin exemplifies this new era of targeted therapies, offering a brighter future for those battling this complex disease. Section 11. Conclusion: clarithromycin, a potential game-changer in oncology. The journey of clarithromycin from a common antibiotic to a potential cancer fighter highlights the evolving nature of medical research. Its unique ability to target the energy powerhouses of cancer cells, combined with its potential to eradicate treatment-resistant cancer stem cells, positions clarithromycin as a promising candidate for revolutionizing cancer treatment. While further research is necessary to fully elucidate its mechanisms of action and assess its long-term safety and efficacy, the preliminary findings are encouraging. The potential synergy of clarithromycin with other anti-cancer agents opens up exciting avenues for developing more effective combination therapies. Well-designed clinical trials will be essential to confirm its efficacy and establish its safety profile. The story of clarithromycin serves as a reminder that breakthroughs can emerge from unexpected corners of scientific inquiry. Clarithromycin, the unexpected cancer fighter, stands as a testament to the power of scientific curiosity and the unwavering hope for a cure.